Most people think that they're relegated to a stroke regardless of what they do. They think that it's genetic or preordained. It certainly is not. People have stroke because of stroke risk factors. And again, there are some risk factors we can't do anything about. If people knew what high blood pressure does and how it affects their stroke risk, they would go out and get their blood pressure checked. And if their blood pressure was elevated, they could take action to reduce the blood pressure. We're very lucky to have the support of the RTH Stroke Foundation. The RTH Comprehensive Stroke Clinic at USC is essentially a place where a patient who has stroke or is at risk of stroke is assessed by a multidisciplinary team.
Without that support, I would not have been able to navigate the horrendous job of trying to help someone who's had a stroke.
The RTH Stroke Foundation, in collaboration with USC, and in particular, one of our colleagues, Dr. Amy Tofigi, have developed the SMART program. And the SMART program really targets high school students to educate them about stroke risk factors and stroke warning signs.
It is paramount that everyone knows the warning signs of stroke.
Focusing on stroke risk factors, behavioral changes, things like that. Also, we have lectures on lifestyle, diet, exercise, anything which informs patients about their stroke risk and how to reduce it. But more importantly, everyone who comes to one of these lectures also is screened for high blood pressure, screened for cholesterol, often screened for disease of their carotid arteries. So you see, in addition to education, we're also providing hard facts about their physiology and empowering them to know what that means.
You just don't let this happen, or this happens, and you know what to do in the next hour, the next day. You don't. One
of the real missions of the RTH Stroke Foundation is education and prevention of stroke, because the best stroke is the one that doesn't happen. If we can educate a group of individuals who then go on to educate their friends and family, maybe we can mitigate and reduce the risk of stroke in their circle of friends and family as well.
In May of 2012, he suffered a third hemorrhagic stroke, which resulted in brain surgery. There are a lot of things that you can do to not only prevent a stroke, but if you or your loved one suffer a stroke, you can recover.
Post-stroke support is vital because stroke is a real life-altering event.
Things were different, but it was normal there. And they loved on him.
It changes everything. It changes the stroke patient's ability to interact with others, to interact with their environment. There are very high risks of depression and hopelessness after stroke. There's also a lot of reason for hope and a lot of reason for being positive.
They became the family and the community that helped me to understand that he can get better and that I can get better along with him.
We know now that stroke recovery can occur for the rest of one's life. So someone who's had a stroke and has weakness of the limb can regain that limb function through directed physical and occupational therapy. Someone who's lost speech function can regain that through speech therapy. And with stroke prevention, they may not have another stroke. However, it's hard to see that when you've had a stroke. So it's vital to have support.
I found the Roxanne Todd Hodges Stroke Foundation, and it was a lifesaver, not only for my husband, but for myself as well.
We have 26-year-old young women who've had a stroke. We have 80-year-old men who've had a stroke. So having a stroke support group allows a different avenue for stroke patients to get that support.
The support from the Stroke Foundation has made a huge difference in both Gil and my life. I am so grateful to them, and I would encourage anyone who has the means to donate to the foundation, because the foundation saves lives, not only helps save the life of the victim of stroke, but the caregiver, who instantly becomes the mind and soul for two people. And it's a hard thing. They help you get through it.